you think about mental wellness, how does that look to you? What do you think of? Yeah. Staying positive, great. Peace of mind, yes. Yes. What else? You can unmute yourself. We can just talk about it. No anxiety, yes. Balance of emotions, great answers here, great answers. Yeah. Not feeling like you're in flight or fight mode, some mind over body. Okay. All right. So we are having relentless positive energy. Wow. Okay. So when we are talking about mental wellness, all these are great answers. Let's look at some of what mental wellness really looks like, right? Uh, so first of all, there's no stress, or that stress, what you're experiencing is within our control. Then, of course, good physical health and good mental health, a good family life, generally positive emotions, positive self-concept, motivation to do something, right? Good friendships and relationships, absence of conflicts, a good work-life balance, a good work life also. There's one part which is like the work life, and then there is a work-life balance. So these are some of the important ways in which we say that if we are experiencing this, we are more or less balanced or more or less in balance. So mental wellness is really a condition of not being stressed or not being ill. So remember, whenever we have an illness, maybe physical or mental, we are under stress, and it's going to affect us a lot. Now we can consider wellness in terms of balance in life domains. So if we look at our life, right? If we look at our life, we have 3 domains that we can say. In some places, you'll say there are 4 domains. So it depends on how they've defined the domain. Now there are these 3 domains. Our personal life. So personal life is all about ourselves, and that comes with our self-concept, our personality, our family, our personal history, and all our needs and wants and everything that is happening with us as individuals. The other domain in our life is our professional life. Our job, our work, our co-workers, our leaders, our work climate, the number of job stressors, even traveling to job and getting home. I mean, all this is related to our professional life, what we are doing at work. And then we have our social life, which includes all the friendships, relationships, co-workers, social associations, memberships. This Maharashtra Mandal is like, for example, a part of our social life. Now, these domains overlap, and they give us maybe economic security, a sense of achievement, pride, depending on where it is overlapping. It can give us a sense of self-esteem when we are doing our job. It may, come to define what we do. So it depends on how we are looking at ourselves. Our social life and personal life, it can give us sense of belongingness, security, happiness, love, and of course, professional life and social life, those intersections can give us status, respect, prestige. And when all these domains in the life are more or less going smooth, then we have a balance in our life. We find balance and we experience either satisfaction or peace or calmness. So it's not this very always being euphoric and being happy all the time. It's more or less a satisfaction or peace. It's kind of a calm period in our life. But when there is a breakdown in any of these life domains, it leads to stress. And when there is disturbance, we experience stress, which can be subjectively experienced as pressure. Like there's not enough time to do something. We are chasing the goals, but we don't have time. So when we say work pressure, that is stress at work. Then there is frustration when there are blocks to reach the goal. So we have set a goal either for ourselves or in our career, or it could be individual, but then there are these blocks. And those blocks again could be many. It can be internal or external. And then we feel frustrated. And then there are conflicts, internal conflicts. We don't know what to choose. We may have one or more choices in life, but we don't know where to go. Or we have a conflict where both are good and we don't know what to choose. Sometimes both are bad and we don't know what to choose. And sometimes, of course, there's an approach avoidance conflict where we don't know whether it's good or bad. So the important thing to know here is stress can start in one domain and spill over in another domain. For example, we are stressed at work and we come home and displace the emotions at our loved ones. Or we may be disturbed in our family and we are not able to do well in our job. So it could be either, or we could be having a bad relationship with a friend, which has probably gone sour, and it affects our personal life. So stress can happen in any domain, and it can spill over. And it's a condition of feeling, it's a condition or a feeling which we experience when a person perceives that demands exceed the personal and social resources available. So what this definition by Dr. Richard Lazarus really means is we feel as if we don't have enough resources. The personal resources are our personal capabilities, personal capacities, our abilities, our strengths. So we feel that we don't have some of this to deal with whatever is going on, or the social resources. The social resources are maybe that shoulder on whom to cry, sharing those feelings, sharing nobody understands me, that kind of thing, where other people are also not able to help you. And that is this feeling of stress. And the important thing is not handling stress in time can lead to many consequences that can cause physical or mental illness, or it can exacerbate existing conditions. So you may already be going through something. It may be a physical illness, or it could be a mental illness, or it could be just a bad situation. But if you do not handle stress, it can make that situation worse, or it can lead to an illness. And that's why managing stress is a very important part of well-being. I mean, it's like stress is the beginning of most of the mental illnesses. Uh, when we look at stress, okay, there are certain categories of stress. Now, first type of stress is a type 1 stress. Now, type 1 stress, it's short term. You know why it's caused. It's like maybe, it can be a physical health. You're having a cold, or you could have had, say, an accident. It's a serious thing, but you know that it's going to go away. Day-to-day stresses that we face, each one of us face. Now, typically, it subsides as soon as the stressor goes away, and some amount of stress is essential for motivation. If you do not have any stress in your life, it may just not motivate you to do anything. So there is an optimum amount of stress that all of us need in our life to make sure that we are motivated to achieve our goals. Type 2 stress, this type of stress is dangerous. We do not know, sometimes we don't know why it's caused. It goes on for a long term. And then, like, for example, chronic conflict with bosses, maybe uncooperative spouses at home, or fights, or team members, or chronic illnesses can cause stress. And typically, these stresses are associated with negative emotions of, say, anxiety, fear, sadness, guilt, shame, anger, and so on. In our Indian context, we have the concept of Shadripu, the 6 enemies. These are all the negative emotions. And of course, negative emotions are important, and that's why they have a part in our life. But when they are not managed, that's the time it becomes a problem. There's also a concept of eustress. Eustress is positive stress. For example, an excitement at upcoming trip, the wedding happening, or something exciting which is happening, and it's typically associated with positive emotions. Why is it called stress? Because the body reacts in a similar way when even when we have positive stress. For example, beating of our heart, right? Our body does not necessarily know whether this is good or bad. It's our emotions which determine. And of course, there's a whole lot of neurological basis to this whole experience. And of course, the distress is the negative stress, typically associated with negative emotions. So these are the categories of stress. And now mind and body are very closely related. And how are they related? Remember, mind is, somebody in the chat said brain, right? Now, mind is really the functioning of your brain. All the processes that are happening in those billions of neurons, which are some 86 billion neurons are there in our brains. And mind is really working off those neurons, and it happens at molecular levels. And there are neurotransmitters, there are hormones, which also act as neurotransmitters, some of the hormones. Our immune system is involved. And chronic stress can be very dangerous to our physical and mental health. Now, let's look at what actually happens. Somebody said flight or fight, right, in the chat. So we are going to look at what this flight or fight is. So let's look at how this process happens, right? So it starts with an external event, which is seen as a threat by an individual. So there's an external event. So for example, you're walking on the road, a very simple example. You're walking on the road and you see something lying on the road and you think it's a snake, right? So it's an external event. There is some rope, or it may be a real snake, and you see it and you perceive it, and you know that it's a threat. And as soon as your body or your brain captures it, suddenly all these stress hormones are released in the body, and what is called as a flight or fight response is activated. So when you see a snake, you can do two things. One is either you can run, or you can take a stone or hit it, or you can attack it, right? The snake may also do the same thing. The snake may come and attack you, or the snake may slither away. So every organism has this flight or fight response. Now, what happens in this response is when the adrenaline, the noradrenaline, cortisol, all these are released in the body, the heart rate increases, the breathing increases, fats and glucose are released for energy. Because remember, the blood flow is diverted from the non-essential body to areas of the body that needs it at that time, like your muscles, your hands and legs, right? So sometimes when you have a lot of stress, you get stomach cramps. Why do those stomach cramps happen? Because the blood is going away from your digestive system into your muscles, and that's why you can get these this type of reactions, bodily reactions. Perspiration increases and the immune system is suppressed. Once either you run away from the snake or you attack it, whatever happens, the threat is removed. Once the threat is removed, another set of neurotransmitters and hormones get released, and cortisol, adrenaline, everything, noradrenaline, all those hormones and neurotransmitters are reduced, and then the body returns to normal. So this is the flight or fight response, or the typical stress cycle. Now imagine if the body does not return to normal, if the stress becomes type 2 and it continues, then what happens is the cortisol and all these stress hormones are there in our bloodstream, and they keep affecting our internal organs. And this is where illness really starts, the physical illness, that part of stress. So chronic type 2 stress happens through a sustained stress cycle. what happens is there is some event like the snake, or there could be an event which is just going on, like a bad relationship with a boss, right? It's a chronic stress. So there is the origin of the stress. Now, this origin could be the actual event, or it could be the perception of an event. And this is very important, how we perceive things. They can lead to uh, negative emotions. So there is an event which can cause stress, and then because this stress, it is also based on our perception, we react to that stress in a certain way. Now that stress can give rise to more stress. So for example, if I have to do a presentation in front of a huge audience, suppose somebody has stage fear, that is stress inducing. And then the reaction to stress could be, I don't want to do this presentation. I don't want to go and talk in front of 100 people. And they will avoid it. Now, by avoiding it, it causes more stress because now they start blaming themselves. They can never do it. They start feeling helpless. It causes more stress. And it could also lead to secondary reactions. The secondary reactions could be, it could be some kind of complete avoidance, running away, you know, behaviors which are not very adaptive. They are called maladaptive behaviors. Now, these behaviors can again result in some kind of psychosomatic problems or mental problems or physiological problems, or it could lead to more complications, and that can keep on adding to more and more stress. So this one event can lead to a whole stress cycle, which can be sustained, and that can lead to illness. And there are so many illnesses: anxiety, depression, impairments in memory and concentration, sleep problems, headaches, muscle tension, pain, digestive issues, weight gain, high blood pressure, diabetes. I mean, you can name it, and it's related to stress. And it can also make existing conditions worse. And therefore, it can also lead to heart attack, right? Cancer, for example, some cancers are related to stress, how your body reacts to certain things. And of course, the suppressed immune function also makes you susceptible to more illnesses. So managing your stress is extremely important for managing your mental well-being. And some of the self-care things, when we talk about well-being, we'll talk more about it. Now, anything in psychology, right? Any psychological process can be explained in terms of what is called as a biopsychosocial model. The biopsychosocial model really says that we are, whatever we do, ourselves or we are a function of three things. Our biology. Our biology has, I mean, that defines what we are going to be, the predisposition to something. It includes things like our genetics, hereditary, right? The nervous system, that's the neurotransmitter, the endocrine system. So everything that's going on in our body, because mind and body are very closely related. Then the psychology of it. The psychology is related to self-concept, thinking, feeling, our own past history and traumatic events, the situations that we are in. Like, for example, there's a sudden flood, there's a loss of loved one, there is, all the earthquakes, the gun violence. I mean, these are all events which are happening around us, which can be very, very traumatic life events. And we react to that event in a certain way. And every time we react to an event in a certain way, we are learning something. We are doing something. So those things that happen, those behaviors that follow. And of course, motivation and personality. So psychology is what is happening in our mind. This is the mental part of it. And it's always related to, again, the psychology is related to three things. One is cognitive. Cognitive is thinking. Cognitive, affective. Affective is feelings. So feelings associated with it, and behaviors. Conative, that is motivated behaviors. So cognitive, conative, and affective. These three dimensions are there in every aspect of psychology. And then we, of course, have the social context, because we are social animals and we live in a social context. So things like relationships with others, expectations from those relationships can be primary, like family, secondary, which are our maybe the friends or others. Very close friends could also be primary relationships. We have work relationships, and of course culture. Culture can create a lot of demands. Culture can create a lot of pressures. Culture can really uh, culture defines all the norms, and therefore what is okay in one culture may not be okay in another culture. Also social media, now this is of course a new source of stress, where all of us are on social media, and we are, some of the people get really stressed out by how many likes have I got, how many followers have I got, and constantly being on social media itself is a very, very it's not a very healthy thing. So the biology predisposes us to certain patterns. So our hereditary, our nervous system, how we are built. So I'll give you an example. When someone is stressed, like for example, if I'm stressed, then I experience acidity or heartburn. That is my way of, my body telling me that I'm stressed. For somebody else, it may be a headache. For somebody else, it can be a shortness of breath. So, depending on your biology, you are predisposed to the way you react to stress. And if it is a chronic stress, you will develop that kind of an illness. So again, make sure that you know how your body reacts, what your triggers are. So it's very important to know all these things. So biology predisposes us to certain patterns, and then learning and socialization uh, governs our response. What we do with that, right? What we do with that particular situation depends on our psychology, what we have learned, what are our patterns, what do I think of myself, how do we think of ourselves, how do we define us, how do we look at others. So all these things define our response to various events around us and our ability to handle these situations. Now, I just gave an example like feeling stressed to do a presentation. I've just taken a very common example that a lot of us would have experienced, or we know people who are struggling to do this. Now, if somebody is stressed to do a presentation, if it's not handled soon, right? If this fear is not handled soon enough, it can lead to psychological problems. It can lead to physiological symptoms. It can lead to feeling physically sick. It could lead to a phobia, for example, or it can lead to severe anxiety. So every time we have to know that if there is anything that is blocking us, we must address it soon. So stress can affect our physical health, like we said, heart disease, diabetes, insomnia, a weak immune system, being prone to other illnesses. It can affect our mental health because when we are under stress, our cognition is affected. Cognition is thinking. Cognition is related to thinking, decision making, uh, rational thinking mostly, right? So it's related to memory, learning. So even for example, if students are very stressed during times of exams, they cannot learn, right? The memory is going to be affected. So making sure that students are not stressed during the exam time or even before the exam, it's very important that they get enough rest, enough sleep, so that the cognition part is taken care of. So, mental health in terms of, again, the stress can affect our self-concept, our relationship issues in terms of when we feel stressed and we are go, going through stress, it can affect our relationship. For example, uh, a spouse or a boss or a team member or a friend, they may say something and we may interpret it wrongly. We may just react to it instead of responding to it. And that can cause relationship problems. And it can just lower our self esteem or self concept. Stress leads to a lot of maladaptive behaviors. Maladaptive behaviors means these are behaviors which we think are reducing our stress, but actually they are not reducing our stress. They are not adaptive. So, for example, addictions. For I feel stressed, so I go and eat a lot of sweet things. That is a maladaptive behavior because eating sweets is not going to take away my stress. It will sustain that stress cycle. Remember, I showed you the stress cycle. It is a maladaptive behavior because by eating sweets, I'm creating more problem. When I'm creating more problem, I'm creating more stress for myself. So maladaptive behaviors, addictions, avoidance, like not wanting to face the stressful situation, is another big problem. It can lead to aggression because you don't know how to respond. And then if you have that kind of, again here, when you talk about the biopsychosocial model, there may be people with aggressive traits. So depending on the traits that you have inherited, it could be like a trait anxiety, it could be aggression, it could be anger, it could be any of those traits. Depending on your personality traits, you may be inclined to behave in a certain way. At workplace, it may lead to absenteeism or presentism. Presentism is where you are at the workplace, but you're not really engaged in what you're doing. You just show up at work. So that is called presentism. And then, of course, economic consequences, because you're falling sick, you may lose work, or there is a loss of work. You're absent for many days. Because of your illness, you have to pay out insurance and all the costs of ill health. So stress has a lot of consequences. So here we are just taking a little pause and then going to mental illness. So I hope this was clear. In the presentation, some of those questions you may be having may be answered in the section on mental illness. So from stress, we move to mental illness. So if you have any questions, please put it in chat. But if you have a question right in top of your mind that you think you need to ask, then please unmute yourself and ask. Or you can use chat, and of course Amita and others are kindly looking at the chat as well, and they can keep a track on the chat. Okay. So we looked at what stress was, the negative effect of stress, what it does to our bodies, what it does to our health. So let's look at mental illness. So stress is highly correlated with mental illness, the type 2 stress especially. And what exactly is mental illness? Now, mental illnesses are broad health conditions involving changes in emotion, thinking, and behavior, right? Cognitive, cognitive, and affective. This is exactly what emotion, thinking, and behavior means. So in psychology, you can explain every construct in psychology in terms of these three things: the biopsychosocial model, and cognitive, cognitive, and affective. So emotion, thinking, and behavior. Now, it is associated with distress and problems in functioning in different areas of life. So we spoke about the domains, right? So this is where different areas of life, it can cause distress. Now here I absolutely want to make certain that there are types of other illnesses which are correlated with mental illness, but they are not mental illnesses. For example, low intellectual disability, which means low IQ, that is not a mental illness. Developmental disability. So for example, autism, it's not a mental illness. Similarly, dementia is also not a mental illness. Okay, so these are all different categories of illnesses. They are not mental illnesses. Now, these disabilities can be associated with problems in, say, emotion regulation or cognition or behaviors. And this is what needs to be managed. And therefore, psychologists, psychiatrists, and other mental health professionals are involved in treating these patients, treating people with these conditions. But these conditions by themselves are not illnesses. So I hope that distinction becomes clear for everyone who's listening in here today. Now, causes of mental illness again goes back to the psychosocial, biopsychosocial model. Uh, it is genetic factors, prenatal factors, maternal health is important, genetics, of course, you are born with what traits you have, personality factors. Now, a number of personality traits are also inherited. It runs in families, they say, right? Or you can see that your mom was like this and your dad was like this and you are similar. So personality traits are also inherited. It can be related to trauma, of course, the post-traumatic stress disorder, or certain personality disorders are directly related to trauma. Then, of course, stress, the whole, all types of stress, chronic stresses can lead to mental illnesses. Early life development, this is very, very critical. What happens in our childhood definitely affects what happens later on. Drug and alcohol abuse. So some of the mental illnesses are a direct relation, directly related to substance abuse. In fact, substance abuse disorder itself is a category of disorder. And of course, a number of other biological factors, which include your physical health and other conditions. Now, remember, having these factors does not cause mental illness. Now, these are all risk factors. Okay, so I may be prone to some illness. Hello, someone's annotating on the screen. So I'm just trying to erase all the annotations. Yeah, if you by chance touch the screen and you go into annotate, you will end up annotating the screen. So, all right. So just be careful. Okay. So different people respond differently. Now, some may manage to cope and others not so much. Okay, so the type of illness will vary based on all these individual factors. So it depends on your genetics, it depends on your personality, it depends on your environment, it depends on your own early history, depends on your memories, right? It depends on all these things. So for every, so these risk factors by themselves do not cause, even if, so say for example, you have inherited certain personality traits, does not mean you're going to develop that illness. It just means that you are more uh, predisposed for that particular illness. Now, what we are a product of what is called as nature or nurture. This is a big, it's like a big debate which still goes on. Are we a product of nature or nurture? Nature means it's everything is written for us. That is how we are, our genetics, our heredity. So we can just blame our heredity for whatever we have. But nurture is what happens with us through socialization, how we are brought up, all those things that we learn along the way, and how we are socialized. Socialization is a process of learning. So when we say we are socialized by our family, by our school, by our religion, by whatever is happening, mass media, all that is part of socialization. And now, of course, social media. That's a big factor of socialization. So socialization is a process of learning through lifespan. And that is called nurture. So nature or nurture. So are we product of nature or nurture? And interestingly, most of the our development is all about choices we make. Okay, so don't think that if there are certain genetic factors, we are going to develop that illness. Of course, there are some illnesses where the correlation between the genetic factor and the illness is very high. So the probability of somebody getting that illness would be higher. So to that extent, yes, it is predefined. Now, remember, the individual differences are the reason people do not understand mental illness and it is stigmatized. For example, if there's an exam and some child is stressed about it And there may be other person who is not stressed about it. Now, the person who is not stressed about it says, hey, why are you so stressed? There's nothing in this. Or I have heard people say, what's there? Why should you be depressed? Right? Now, remember, these mental conditions, people are having it because of their individual differences. It's not that they have no options. It's because they probably do not know how to deal with it, and that has caused it. But because there are individual differences, people don't understand mental illnesses very well. Because, for example, if I say I have a cold, if somebody has a cold, for everybody, the symptoms are all similar. It is caused by a virus. And when I catch a cold, I sneeze and I cough and whatever it is. So everybody pretty much does the same thing. Not so with mental illness. Even two people having anxiety disorder are completely different. So the way we treat these two people is completely different because they come with very different backgrounds, very different nature nurture combinations, very different circumstances. And therefore, these mental illnesses are not understood and they become stigmatized because somebody who doesn't have a mental illness feels that what's wrong with this person? How can they be depressed? How can they be anxious? And this is one of the reasons to understand that people are different and therefore it's okay. Somebody is going through something and it's it's their individual package, right? We are all unique. We are all different. And what illness we end up with is based on our own individual package, whatever. So I may deal with something in a very different way. My husband may be dealing with it in a very different way, and my brother may be dealing with it in a very different way. So there are different types of mental illnesses. Okay, some main groups of mental disorders are like mood disorders, anxiety disorders, personality disorders. There's a whole bunch of psychosomatic disorders. There are psychotic disorders such as schizophrenia. Then you have eating disorders. Then trauma-related disorders like PTSD and substance abuse disorders. So, of course, this is this is just a list, like the main groupings. There are many, many, many different types of mental illnesses. And they are diagnosed, okay, they are classified and diagnosed under, there are two international classifications. One mostly used in Europe and UK. It's called, even in India, for example, we use ICD, that is International Classification of Diseases. So this is a manual. So this manual tells you, it describes each and every disease. Okay, so, and then the diagnostic and statistical manual, which is in USA. So now these manuals are big, thick books. Like, for example, the DSM may be having like 3,000 diseases which are described. They are like descriptions of these illnesses. And they say that if you have these symptoms, then, you have this disorder. So they kind of describe each and every illness with the symptoms. And these manuals are very important for professionals. Because if I say somebody has, say, an anxiety disorder or an obsessive compulsive disorder, the moment that diagnosis is made, then everybody in the field knows what we are talking about. It brings a uniformity to that particular illness. So this is used by professionals for scientific diagnosis by certain markers that a person has got this illness. The problem with this kind of thing is, of course, people start labeling. And these days, what has happened is people are using these terms in very loose ways. Like they say, I am depressed. Even if somebody is feeling sad, they say, I am depressed. Now, sadness and depression are two different things. So I've heard people saying, oh, I'm having OCD. They may just be perfectionist, or to some extent they are perfectionists, but they say I'm an OCD. So this kind of labeling can happen. So people need to be very careful how they're using these labels. Sometimes these labels can lead to other issues. One is, it's called a self-fulfilling prophecy. Okay, this is very important in, it's not a part of the slides, but I'm just talking because I'm talking about labeling, how you label yourself. So say, for example, you say, I have OCD. Now, the moment you label yourself, your behaviors will be in such a way that it fulfills that prophecy that I'm OCD. I'm doing this because I'm an OCD. So directly you are uh, attributing your behaviors to a label that you have accepted. And this can be detrimental to your own health because it limits you when you start labeling yourself. Similarly, when you label other people, for example, you say, he is stupid. Using the word stupid to describe somebody is very detrimental. It can lower the self-esteem of this person. It can start making that person feel very low. So it's very important that we mind what we are saying. Okay, especially we can, and if we are diagnosed with that illness, then yes, we need to accept it and make sure we are getting the right treatment. So how does a diagnosis happen in mental illness? So when we feel that the stress is too much, okay, when we are not feeling well, first thing is we have to seek help. So go to your doctor or go to some friend, go to somebody and talk about it, right? Now the doctor, if you're really feeling ill, okay, your sadness is just going on for a long time and not getting better, or your anxiety is just interfering in your day-to-day activities or whatever it is, or you just feel like craving for some food and that's reducing your stress. So know that something is not okay, go to a doctor. Now the doctor takes a detailed case history. Okay, the mental health professional, right? They take a detailed case history, and then there are certain observations and assessments that happen. Now, first thing is medical diagnostic tests. Now, these tests can be like your blood test, it could be your ECG, it could be your, brain tests like EEGs and others. These are especially important when the symptoms or that illness or that problem is serious, like maybe certain psychosis, for example. There are serious mental illnesses, so you want to make sure that you're ruling out all the physical neurological issues which are there, which may be there. For example, certain psychosis or certain kinds of disorientation can happen because of, say, brain tumors. It could happen because of a brain injury, or it could also happen because of certain seizures which are happening inside the brain. It may not actually, somebody may not have a full-fledged convulsion, but it can be happening inside. So all these things are, not for everything, but if there are certain symptoms, there could be diagnostic tests which are run. Then we have psychological tests. Now, psychological tests uh, are highly standardized. They are psychometric tools. Now, psychometric tools are very standardized tests which have been tested on thousands of individuals, right? And they are valid tests. So, psychometric testing is very important. They can be objective. Now, objective tests are something like a scale or a questionnaire that has certain norms, and if you are above this, then you may be having anxiety, or if you're below it, then you don't have, and whatever. So for different things, so you have many tests like Minnesota multiphasic inventory, MMPI. You have the Beck depression. You have so many, that there are many of these tests. And there are something called projective techniques. Projective techniques, you might have heard about these things, like the Rorschach ink blot test, the thematic perception test, TAT. So these are all subjective. So both the subjective and objective tests are administered. Now, remember, not for everybody. It depends on the condition. Sometimes the clients come and say that we want a test. I mean, as professionals, we may think that no, this person doesn't need a test, but sometimes the client says, I want a test. So at that time also you can, and then sometimes even we as professionals need our clients to take the test for a differential diagnosis. We want to know exactly what is happening. And then, of course, behavioral observation. So many times, for example, people with, say, people who are having seniors who may be having dementia, or just they're doubting these things, or children maybe, who are having some behavioral issues, or maybe even autism and other things. So behavioral observations are important. And then based on these test reports and this detailed case history, I cannot emphasize the importance of a case history. It is extremely important, and there are protocols for taking case history also. So for example, in our institute, in Swasti Vishwa Institute, we follow the NIMHANS protocol for case history taking. It's a very detailed document, which is extremely essential to make a proper diagnosis and understand what is this underlying condition. So make sure that you go to a qualified mental health professional for a proper diagnosis. This is very important because your treatment depends on this diagnosis. And we have had clients who have been misdiagnosed because a detailed case history was not taken, because assessments were not done. And that person was on wrong medications for months. And it had, it was really devastating that and there was no case history. So make sure that when you go to a mental health professional, if at all you go, and suppose you suddenly say that, hey, they are not taking a case history, then please ask them, like, what's going on? Because without a case history, a proper diagnosis is not possible. Sometimes, mental health professionals also may take shortcuts, and it's not advisable. It's not the correct thing to do. So now when we come to the treatment options, we have got medicines, we have got counseling, therapy, and there are other approaches. So in professional treatments, we have psychiatrists who are doctors with MD in psychiatry, and they prescribe medications. Now, what we need to understand is we should not stop medicines without the doctor's advice. A lot of our clients, when they start feeling well, they just stop their, they just stop their treatment by themselves. It is very dangerous. Please ask your doctor and talk to your doctor before stopping anything. Counselors. Now, counselors are people, professionals who help the client in making certain decisions. If there are any problems, they help the clients in addressing ongoing conflicts. Okay, there are in specific domains like couple counseling, career counseling, counseling for children with learning disabilities, parental counseling. So counselors also work in field of mental health. And then we have psychotherapists. These are professionals who have advanced degrees in clinical psychology, counseling psychology, behavior medicine, and they work with clients to help them deal with dysfunctional thoughts, emotions, behaviors using very advanced techniques. And they are trained in specific evidence-based approaches. And we also have a whole class of professionals who are called psychiatric social workers. Now, they work in mental health care settings. They do outreach work, they work with patients, they do home visits, and they do a lot of psychoeducation as well. And then there are other allied healthcare workers like occupational therapists, special educators. So these are all allied healthcare workers, speech therapists, physical therapists, who also help people with mental illnesses. Now, because people don't know a lot about psychotherapy, I have just included one slide about psychotherapy. Now, people get into therapy to get well, to treat their disorder, to alleviate their distress. So they, want to talk to somebody, and people to develop more adaptive approaches and to break out of these stress cycles. So what happens in therapy is, based on the training and orientation of the therapy, a method is chosen. Like there are psychotherapists who may do psychodynamic therapy, behavior therapy, cognitive therapy. So for example, my mode of therapy is cognitive behavior therapy, and I've got advanced certificates in cognitive behavior therapy. So my orientation is CBT. So like this, there are psychologists who are trained in different types of therapy, and then they can help their patients or clients through different formats. So adult psychotherapy, It could be family therapy, it could be couples therapy. So they could provide therapy for individuals and groups. Now remember, process of therapy is a very collaborative process. Okay, now, and therapy can go on for, depending on the severity of the illness, the type of illness, it can go on for less time or more time. And of course, the success of therapy depends on, one, the expertise of the therapist and the commitment of the client to change. And in a lot of times when the problem is a little severe, it has to be in combination with medicines. So this combination of medication and therapy is the most has the best outcomes for the clients. And it's a myth to say that medicines are harmful and medicines are not useful. Medicines are useful. And of course, the therapists also provide psychoeducation. This means educating the patients and their loved ones about the illness and how to understand that illness, cope with the illness, and how to respond to a person with that illness. Because suppose you have a person with depression at home, you don't know what to say. You don't know what thing will trigger their thoughts, right? So a lot of our work also, is in the area of psychoeducation. So you need to know about the mental health condition. You need to know about the treatments, understand the nature of illness, okay, know how to respond to the person with a mental illness, know what support to look for. And also the caregivers have to ensure self-care. So when you are caring for somebody with mental illness, especially if it's a chronic mental illness, then you need to do self-care as well. So psychoeducation is all about this. Now, when we are talking, so all this was about mental illness, and now we come to mental wellness. Okay, so how do we deal with it? So mental well-being and self-care actually has these 4 pillars. One is attitudes and beliefs. So having a realistic self-concept, dealing with our negative beliefs, emotion regulation, like you need to know how to manage your emotions. Having a growth mindset, learning skills. Now, literally each one of this can be a workshop on its own. Okay, these are all very, very specific methods of this and how to do it, how to grow in this. Then learning different skills, learning assertiveness, and then of course managing physiological responses. Now, this is extremely important in self-care, like exercise, breath work, relaxation, meditation, massage, biofeedback mechanisms. But at least these 3 things, the exercise, breath work, relaxation, we all can do every day. So it's something that we need to take care of. And this is very important because number 1, it's very easy to do. And number 2, remember the mind-body relation. Even if you're going through stress, your stress hormones will be in control when you do this. So make sure that even if you can't do anything else, do these things at least regularly. And you can do all this art of living, the Isha Foundation courses. You can do any of those things. They are wonderful for managing your stress. Of course, changing lifestyles, exercise, diet, sleep, relaxation, hobbies, and spiritual growth. This is again another critical area that we all need to focus on in terms of our lifestyle change itself. And then managing relationships. It's all about accepting the other person, showing empathy, emotional intelligence, kindness, gratitude, appreciation. All these are to maintain social relationship. And in a recent Harvard study, when they did mental well-being and mental health study of, it was a big study that went on for 50 years. What they found in the study was social relationship is that single factor that contributed to mental well-being against all other factors. So social relationships are a huge part of our life and we need that support constantly. It could be your friends, it could be your family, it could be but you need that somebody in your corner, right? So managing relationships. Now, I have developed a model through my practice of the last 30 years, which I call 7 powerhouses of motivation. And if you apply these 7 powerhouses of motivation, it will foster well-being. So these are self-efficacy, your belief in your own capabilities, optimism, belief in positive outcomes, and building resilience. These are again very important concepts in well-being. Praise, offering praise to others and to ourselves, when it just reinforces the positive. So all this is coming from the positive psychology orientation. Gratitude, focusing on positives that we actually have in our lives and expressing appreciation. So gratitude doesn't mean just thinking in our head, but actually expressing it. Kindness. Kindness is acting, indulging in acts that help others. And studies have found that if a person indulges in kindness, their feel good hormones are released and the person is physically feeling well. And even the person who is observing an act of kindness also feels well, feels better. So this feel good thing about kindness, it is very, very important. Be kind to each other. Creativity, discover and use your potential to the fullest. All of us are born creative. If somebody says I'm not creative, it's not true. You just don't know. It's hidden. So figure out what you're good at. It could be the arts, it could be just problem solving, it could be just creative thinking, it could be music and dance, and just so there is actually a entire therapy which is based on creativity. Expressive arts therapy, it's called the dance movement therapy. So there are a lot of therapies which are art based. And of course, spirituality, which is finding the purpose and meaning in your life, connecting beyond yourself. So don't think, just about you. Just expand your thoughts and transcend yourself in terms of where you are on the motivation levels. So transcending yourself. So all that is related to spirituality. And where do we begin? So first thing is me time. Take time for yourself. Every day, do something not for anyone, but for yourself. Be kind to yourself. Say three things that are good about yourself. When in my workshops, when I ask people write three things, positive things about yourself, some people can't even write positive things about themselves. But think about your own self and how good you are, and keep them as a reminder. Reframing our thoughts, like negative thoughts into positive thoughts. Like, remember, positive thinking is not very important. If I'm not capable of, say, climbing a mountain, I should accept that I'm not able to do it. But it doesn't mean that, it doesn't, so positive thinking does not mean just having positive thoughts. It has to be true, right? But I can reframe my thinking. If I'm thinking that, I'm going to fail in every paper, then how can I reframe? Am I going to fail in every paper? No. There is a possibility I will be passing. So this is the kind of Socratic thinking. A lot of CBT, therapy uses all these techniques. Reflective journaling, traveling, being with nature. So just be yourself, reflect. Okay, become organized. If you are in clutter, you are stressed. Learning to say no. This is again another important, very important aspect of being assertive, which is related directly to your stress levels and mental health. Reading a book on self-care, just taking self-care in your own hands. So this is something that you can easily start literally like today, right? Now, again, coming back to the full circle, we began with the three domains in life, and its mental well-being, therefore, is all about finding the right balance. So reach out to someone for support. And if you cannot deal with it, please see a qualified professional who can help you to work through the process of healing. And remember, seeking help for stress or mental illness is not a sign of weakness. It's in fact a sign of strength, that you are taking care of your own mental health. So please seek help from the proper professionals. And you can do whatever you want. If you don't want to go to a psychologist, first you can go to somebody who you think can help you. You can go to a priest, you can go to a guru, you can follow your own. We never tell people don't do something. If something is making you feel good, try it out. And if you still are feeling, if you are still struggling with thoughts, yes, you can see a professional. However, it is very, it's beneficial if you see a professional right away, because we do have clients who have tried everything and then come to us. And lot of times we tell them, if you had only come to us before, like earlier in your struggles, we could have helped you better. But then those choices are personal, and do what makes you feel good, and what makes you feel empowered. And there are a lot of choices. Mental illness is not something that is not curable. People do have cures. Science has advanced a lot. Techniques have advanced a lot. When I began 30 years ago, there were not so many techniques as they are now. And we as professionals are continuously improving ourselves through advanced courses. And these are the techniques we bring to our clients and their families. So with that, I hope you enjoyed this and learned something. And I can take any questions. I'm sorry I overshot a little bit in terms of time, but I hope it was useful for all of you. So thank you so much.
Thank you, Swati. Thank you so much. I think you did great on time. I don't think you overshot. आपला हा session 9:30 पर्यंत आहे. So I think we're doing good.
Oh, okay. I got scared that, I was overshooting the time, 7:30 to 9, I thought. So
No, you're doing fine. So, if anybody has any questions, you have two options. You can either put them in the chat, or you can unmute yourself and ask.
Hey, Swati, can you guys hear me?
yes, hi. Yes, Prashant.
Hi. Khub Chan, very informative webinar.
Thank you.
Really, one observation is like, we typically, Desis mana kya Marathi mana, whatever, we are fairly smart people, right? Or sometimes we feel that we know everything. We can read a book, we can Google something and, fairly get some decent knowledge. But a professional who has been really deep into that area really provides a lot of good insights, which you typically don't think about, or you don't connect those dots that way, So Malakup Shikala mein lechatna. So thank you for taking the time and doing this for MMD.
Thank you
That's
so
what I wanted
much.
to say. Yeah.
Oh, it's my honor and pleasure that I was able to do this presentation. And I hope people understood mental health in a different way today than whatever they have understood so far. Because there are too many myths, too many wrong thoughts or wrong ideas about mental health and mental illness. So I hope this was useful for everyone.
And thanks, Amita. Thanks, Amita, for moderating, for being the host.
No problem.
Yeah, this is Amit. I echo Prashant's thoughts. So, Swati, thanks for accepting my invitation to do this seminar and working with us. It was really very informative. Thank you very much. People don't realize the importance of mental wellness as much as they should be. So I'm sure this must be an eye-opening session for everyone.
Thank you so much. Thank you so much for that, Amit. And I again thank Maharashtra Mandal for inviting me to do this webinar. And I'm here anytime. If somebody wants to reach out to me, they can.
Yeah.
There's a question. We have a question in the chat from Ashish. How should one know that he or she is suffering from mental illness?
Oh, okay. Yeah, so this is a very subjective, subjective experience. So, so who has asked this question? Can I ask them to clarify their question a little bit? They can unmute themselves. Ashish. So can you unmute and ask Ashish what exactly you're trying to say?
What I'm trying to say is like, when is the right time to seek a help, or what is that point? Like,
okay.
You think like it is okay, it is normal. Sometimes you feel it's not normal. So
yes,
about it.
Got it. Okay. So one thing is, if your whatever you're experiencing is interfering in your life or interfering in other people's life, okay, then you seek help. Because some amount of anxiety is normal. In fact, anxiety, sadness, everything is normal. People must experience these emotions. But if it is going out of hand and it starts interfering in your relationships, in your productivity, in your own day-to-day life, then that's the time you have to go to a mental health professional. Or if it is causing problems to other people also, then, other people will tell you, hey, you need help. So that's the time you must. Did that answer your question, Ashish?
Yeah, I got it. Thank you.
Yeah. Any other questions? I am not able to see YouTube, but if somebody has asked over there, then I can go back later. How do you take or administer CBT, or is it self-programmed? CBT is cognitive behavior therapy. So you have to go to a therapist, and this is a method of therapy. It's a type of therapy where the therapist is trained in that. So it's not like computer based or something. Of course, I'm sure there are going to be apps very soon which will help to deliver this. So, but that's in the future with generative AI and all that. I'm sure things are going to come in that direction. But CBT is something, cognitive behavior therapy. So there are it's a specialized form of therapy, which is highly evidence-based. So evidence-based therapies means there are a lot of studies which have happened. It has to be done in a particular way to see particular outcomes. So that is an evidence-based therapy. So did I answer your question, Dr. Anand?
I'm sorry, my dog is barking in the back, but I have one question.
Yes. Right.
So we went through all the slides and it was a great presentation with a lot of information. My question is, as we go through all these different mental illnesses, right? Like somebody may be going through depression, somebody may be going through a relationship conflict, somebody else may be suffering from anxiety. How do you find the right therapist for your specific problem, right? Because if you Google, there is a plethora of things, and then we have insurance in this country to consider also. So how does one fight? What are the questions we should be asking to make sure that we have the right therapist for our specific problem?
Yeah, good question. So typically when the therapist puts out their profiles, they would have said that I deal with, say, adult psychotherapy, and they also say their approach. On their profiles, it's written like I follow CBT, DBT, REBT, whatever, or I am a psychoanalyst or psychodynamic approach, interpersonal therapy approach. So they put their approach. They also put the population they work with. So some of them may be working with just children, some of them may be working with seniors. So you go and actually look at the profile of the practitioner and also profile of that practice. Sometimes the practice also has, specific psychologists or mental health professionals for specific things. So you must look at their profiles.
Thank you. And I think my question is a gateway to Ashish's next question, which is in the chat.
Comment. MMD share the list. Oh, good therapist. So, yeah, there are a lot of practices in Metro Detroit. I mean, a Google search can really give you a whole list of the therapists. Go by the ratings. Okay, go by the ratings. If there is a word of mouth, that always helps. But yeah, I mean, if MMD can share the list, then maybe I can help you help create a list. But they are available on Google, and you'll have to, look at those therapists. Make sure they are licensed to practice in the US and in Michigan. And this is the reason I don't advertise my practice here, because my practice is in India. So I don't have a license to practice in Michigan. So if at all somebody comes to me, typically they are people of Indian origin, Indians who come because They relate better to me culturally. But I tell them that I don't have a license. Is it okay with you? And I make sure that they have emailed, and all my practice is through my institute, which is in India. And good, please make sure that they are licensed to practice here, so that, you know.
So are you recommending that we should prefer to go to specialist who can understand your background? Or if I'm Indian, I should be looking for an Indian psychologist?
No, I am not recommending that. It is the clients who sometimes feel that
No,
a
I'm
person,
asking
yeah.
because does it make sense? Like, or is it okay to go to?
No, it's okay to go to anybody. Okay, but then there are people who feel that an Indian psychologist will understand their issues better, because culture plays. Mugdha has asked, what's the role of culture while seeking a therapist, and that's where it comes from. You know, how well the therapist empathizes with the client. It happens with me also. Suppose somebody comes to me and I cannot really empathize with the client, I actually pass on that client to some other therapist, because that rapport building and empathy is very, very important. It's in fact the foundation, and it's the most crucial thing for therapy to succeed.
Can I
then I'm
suggest
not,
something?
yeah, go ahead.
Sorry, I didn't mean to cut you off.
Right.
But just for Ashish's sake, right? If you are employed in Michigan, there is something known as a EAP program, Employee Assistance Program, that every big company has. Via the Employee Assistance Program, you get 5 free therapy sessions per family member per calendar year. This is something I have personally made use of. So that is a great opportunity for you to try a therapist, so that you can, because normally I'm sure, Dr. Swati, you agree, it takes more than a few sessions, right, to kind of connect and get going. It's not like taking a Tylenol and fixing it, right?
Ideally, Amita, it shouldn't take 2 or 3 sessions to build a rapport. The rapport building happens pretty much if the therapist is good in the first session itself. The case history taking, or even that first call, you should know whether you can empathize with that client. I'll give you an example. I had a young girl who came to me. Of course, this is in India, it's not here. But the stuff that she was telling me, she was a youngster, like 18, 19-year-old, living in Mumbai. And it was like the things that she told me, I would have started parenting her. So I said, you know what? Probably I'll refer you to somebody else who can probably help you better. So, a therapist is not our client's parent or a friend. They must be able to empathize with that person in their shoes and respond appropriately. It is a very different, it's a thing that we learn through our education and skill and experience. So we have to be very ethical, and we have to be very self-aware as therapists, whether we can empathize with someone, and we can, be empathy is not even just being kind to somebody. But I referred her out. Similarly, long ago in 2006, there was somebody with, gender identity issue. They came to me. And at that point, even I was struggling with this whole gender identity thing. It was just coming out, like, in earlier DSM, gender identity was listed as a disorder. Now, because it has become more acceptable, it's no longer a disorder. But as therapists, we did not have any training in this field. So at that point, I referred the case, the client, to somebody else who could help them better than I could. So like this, typically in the first session itself, you should know whether this therapist is okay for you or not.
Thank you. Ashish, I hope that helps.
Thanks for recommending the program. I will check with my HR.
Yeah.
Dr. Swati, Bhushan Kulkarni here.
Hi.
Yeah, great presentation. Learned a great deal. I have somewhat a dumb question about self-realization. When you think personally that you are not taking stress, and everybody around you is telling you that no, in business you always take stress, and you don't feel like you're taking stress. How to identify it and make sure that you're not dealing with long-term implication of stress by not having self-realization?
So let me ask you this question. If I've understood it properly, what you're saying is, suppose you are not feeling stressed, then
Yeah.
do you know that you're not feeling stressed?
Yeah. So,
Isn't it? Huh.
yeah. So I don't feel that I'm taking stress, but if all entrepreneurs around me tell me that, well, in business we take stress, you must be taking stress, and you're not reflecting that stress to your loved ones or at work. But then, is there a way to identify and have some self-realization that you may be taking stress and it may have a long-term implications on the health, or just ignore and just live life? What do you recommend?
Okay, so stress is very subjective, right? In fact, it's reminding me of a client who came to me way back in 2007, and he said, other people are telling me I don't have self-esteem. Okay, he actually came to me with this problem. Other people are telling me I don't have self-esteem. And I said, what makes you say that? Like, why are they saying that? So he said things like, and that time India was growing economically, and everybody was having these fancy cars and the Toyotas and the Fords and everything was there. And he comes to me and says that, yeah, because I'm not running after a house, I'm not running after a car. Mujhe wo chahiye nahi. To but people are telling me I don't want all this because I don't have self-esteem. I said, what do you think? And he says, "Mujhe to kuch nahi, I don't feel anything. Like I don't feel like owning a Toyota or owning a whatever Ford or whatever that was at that time." I said, which means you're satisfied with what you have, right? You have transcended the self-esteem and you have gone to a self-actualization. You are at a higher level of motivation and therefore you are not stressed. So he was very happy with that answer because he was satisfied with what he had, and others were telling him that, he didn't have self-esteem. I said, self-esteem is different. You have actualized yourself. You have gone beyond self-esteem and you are happy. So stick with it. So similarly, if other people are telling you that you may have stress, but you are not subjectively experiencing it. Are you unhappy? No. Are you, are you having some distress? Are you losing your sleep? So there are symptoms of stress. Are you suffering from any of those? And if you're not, then you're pretty good at what you're doing. You are following your passion and your purpose, and your business is giving you a lot of meaning in life. And you're not stressed. So other people cannot tell you that you are stressed. And if you really want to know, let's do a self-assessment. There are a lot of psychometric tools which help you to realize if you are stressed or not. So there are objective measures which will tell you, which I did with that boy, because that boy actually told me, "Ma'am, mujhe ek test de do ki, I want to know. So finally I gave him a personality test and I said, you didn't need that test, but he wanted it because he just wanted to have that validation that, he is not having low self-esteem. But no, you are like, we know, right? Subjectively, we know if we are stressed. So if other people are telling you, then they may be concerned about you, but you know yourself the best.
Oh, thank you.
I'll give you another example. Actually, this is a very important question because I'll give you an example and I don't mind telling who it is because it's my dad and he loves me. And if I tell his example, he won't mind because this is very important. So my dad was going to undergo a small surgery. Now, my dad has never been admitted in a hospital ever. He's 85 years old. He has never been to a hospital. And he was going to have this small surgery, hernia or something. And he was stressed, okay, but he was not subjectively feeling stressed. But the stress was like, my mom called me and said, please talk to your dad because he's stressed. Okay. And I said, what is he doing? Okay, what is he doing? What is he saying? What is he doing? Says that he gets up in the night and keeps writing down things to tell the doctor. Like getting up in the night and writing things down. And then I talked to my dad. I said, Nana, are you stressed? And he says, "Nahi, nahi, nahi. I'm not stressed at all. मला काही stress झाला नाही. मला काहीच वाटत नाही. I'm not stressed." I said, "But why are you getting up at 2 o'clock in the night, writing all your symptoms to talk to the doctor?" So you are processing stress in a different way. You are stressed, but it's being processed in a different way. The emotional component is less, but cognitively you are stressed. So here's where the cognition, emotion, and behaviors. See, the cognitive, cognitive, and affective is there, right? Then I spoke with him, and just after, a little bit of talking with him, I made sure that his stress went away. So, but yes, he was not physically, emotionally feeling the stress, but, and otherwise he's an emotional person. It's not like because people also have what is called as an emotional disposition. Some people feel emotions very intensely, and there are other people who do not feel emotions intensely. My dad is a person who does feel emotions, and he is emotional, but he was not expressing emotions, or he was not experiencing the stress in the emotional component, but the cognitive component was there. So I
No,
hope
thank you.
this
Thank you for
added.
that example. I can relate to that exact example. Thank you.
Okay. And if you are stressed, then yeah, the art of living, the breathing, all those things, self-care. Self-care is very important. Somebody has written in the chat.
I think they're asking if you can share the slides of this presentation.
Absolutely. And this is also live on YouTube, so it's going to be there forever. So I'll share that the YouTube link is also there. So
Thank
I'll
you.
share that. Yeah. So nice questions, because these are very important questions. So thank you for asking questions.
Ashish has another question. He's asking if laziness is a sign of stress.
Laziness will be a sign of stress if you are lazy for avoiding something. Then it is a sign of stress. Like otherwise, just laziness is a behavior, right? It's a behavior, not necessarily a sign of stress. But if you are being lazy because you're not wanting to do something or you're avoiding something, then yes, it is a sign of stress. I hope that answers the question.
Hey Swati, this is Prashant again.
Yes,
So
Prashant.
I have a question, which is a common thing that we are seeing in the youth of today, right? Is they are stressed in many ways from different angles, socially, academically,
Yes.
career-wise, or just adjusting to the culture, right? Talking about Desi kids, for example. So we see that a lot of kids are going and getting some help. My concern as an adult or as a parent, if you will, right? Some parents must be definitely, other parents must be definitely feeling or having that question is, let's say your kid is going through therapy, right? And the concern that I would have is how long do they continue that? If everything seems like okay and they're coping and they understand they've gone through that for some time, my concern is I don't want them to be dependent on therapy for everything in their life. Need to make some decisions. They need to be on their own and go through stress. Like you said, stress is a part of life, and we've handled we've kind of our generation has seen that, our prior generations have seen that, and we have coped with it in our own ways, right? Correct, wrong or right? But now the question to you is, as a professional, I mean, obviously all the professionals want the patients to keep coming to them, but when is a good time to really wean off or say that, you know what, I think I know what the issue is. When I think I'm ready to kind of try living life on my own.
Correct,
Right?
correct. So let me, begin by saying that therapists do not want their clients to be in therapy, because one of the ways we measure our own success is how much we have helped our clients. That is our own, our esteem comes from there, that we feel successful in our jobs. So in fact, we are very stressed if our clients are not showing any improvement. That's number one. Secondly, an expert and an experienced therapist will make sure that the client is learning. This is the CBT model. The cognitive behavior therapy model is the most evidence-based for this very reason, that the clients become self-sufficient and they're well on their way. And in our experience, even if a person, say, for example, has been like, I have handled very severe cases of depression, anxiety, or, many complicated disorders as well. People start they start weaning off therapy as they become more and more self, in control. And that's what therapy is all about. It's a journey of learning. So no child or adult or anyone should be in therapy for a long time unless they have an underlying personality disorder or something. People with personality disorders or very those who have had traumatic experiences through childhood, and there are other conditions also, they require therapy for pretty much like a year, 2 years. But a lot of people, just within like 3, 4, 5 months, they start feeling better. So, but then if somebody is diagnosed with severe disability, severe disorders, or personality disorders, they can be in therapy for a longer time. So it depends on
Great.
them.
Thank you. That was informative. Yeah.
Oh, by the way, before we stop, Kalyani is here. Kalyani is my associate from Swasti Vishwa Institute. She got up very early to, I think, we had some problem with YouTube. So I think she got up and she did something which made it work. So Kalyani, as always, grateful to you. She joined us as an intern and she's our full-time employee now. And as always, very, very grateful to Kalyani. So thank you so much, Kalyani, for your help and, jumping in here and rescuing me from the technological challenges that I face. So thank you so much. So I don't know if there are any questions on YouTube. I'll probably go on chat and answer them afterwards. Yeah.
I don't see any other questions on the chat. I think we have about 15 minutes left. So if anybody else has any other questions, ask them now, or we can then start wrapping up. Ashish is
Personal
asking.
situation.
Yeah.
Yeah, you want to ask here or you want to ask me? No problem. You can ask.
Okay, so this question is related to my wife. She
Okay.
has recently gone through surgery for breast cancer, followed by chemo and radiation.
Okay.
And now she is recovering, but obviously, like we are here, she's attached more to India, and she's like kind of disconnected from her routine for last 4 or 5 years. And since we came to US, she has gone through 2 surgeries. First, she had like full rectonomy, like her uterus was removed, and immediately after a year and a half, she went through this trauma. So we are just looking for some healing process, or like what could accelerate her recovery. And the doctor recommended us to like go for therapy sessions.
Yeah.
Okay, and the thing is, like, if you're able to share in those sessions, it might help you. But because its culture is so different over here, so probably we may relate, we may not relate. So she's kind of reluctant, and because of absence of some like Indian pity or like something like that, you know what I'm saying. I'm not able to
Yeah,
explain properly, but So I'm just looking for some direction in that. Like
Sure.
if I
Yeah.
get some contact details
Yeah.
or numbers or
So
something, I can reach out to.
definitely you can contact us. I will put my phone number here, 248-795-9906. I've put that in the chat. Please send me a message. I can link you to my institute. We have phenomenal psychologists and therapists. They deal with, and I have a large group. I've trained more than 250 professionals across India in CBT, in association with Beck Institute USA. So we have some phenomenal therapists. There are therapists who are working in the oncology field also, providing therapy. So definitely we'll find the resource for you.
Thank you.
Thank you. And so just one question, Ashish. You are all here in the US and you have been here like all the time, right? Or what?
Yeah, we are
Okay.
here. Like I'm working here, and
Okay.
like we are settled over here. So
So yeah, all the best to your wife, and I hope she finds the help, and we'll definitely, give you those resources.
she's also listening. So yeah.
Yeah.
Thank you.
So wish you a speedy recovery.
Yeah.
All right, I don't see any other questions. So do you want to stay on for a few minutes or do you want to start wrapping up?
I think it's like 9:17. We can start wrapping up. If somebody has a question, they can ask in the chat till we end the meeting.
Okay, thank you so much for sharing your number. I know that that was really appreciated, and I'm sure Ashish will get in touch with you. And if anybody else does, we're going to share this presentation, and it will have Dr. Swati's contact. So, you can feel free to reach out. I know sometimes asking a question with other people present can be very intimidating. So, Ashish, kudos to you for going out and about and asking that and not fearing being judged. So good job on that. And thank you so much, Dr. Swati Karve, for giving us your time, for going through the slides, for explaining it down and dumbing it down for us. As an Indian society, I know we kind of consider it like a failure on our part to get therapy, or we think we don't treat mental illness the same way as we treat physical illness. But the Western society or the US society is not like that. I can just say from a personal experience, right? Having taken therapy through that EAP program and through another therapist, if I were to say one thing about it, I would say it's like a spa for the brain, right? Like as a woman, we go, to the beauty parlor or whatever, or we go to the spa. But once you have a spa for your brain, there is no feeling like it.
That's really amazing. That's a great way to put it. I'm going to borrow that quote from you and use it with my clients and with my other mental health presentations that I do. So
no problem. You're welcome. And thank you everybody for joining and giving us your time. And we hope you had fun and learned something listening to this session. Thank you.
Thank you very much.
Thank you
Thank
so
you all.
much. Thank you, Maharashtra Mandal. Thank you, the team, Prashant, Amit, Amita, Sonali. Thank you so much and Anju. So thanks everybody for, working with me, and it was such a pleasure. And I'm here if you want any more presentations on mental health or positive psychology or anything, I will do it gladly, because this is my passion and my profession. And yeah, so I offer my services.
Prashant, I think you have to go on mute.
Sorry.
Okay.
All right. Thank you so
Okay.
much.
Thank you very much.
Thanks everybody for
Okay,
being
thank
here.
you. Thank you. Good night. Bye.
Good night. Bye-bye.